Hey guys, welcome back to my channel, The Purpose Nurse. If you have been on my channel before, but if it is your very first time, then I just want to say welcome. On my channel, I talk about faith, purpose, nursing, and most importantly, just inspiring you all to pursue purpose. And for me, I pursue my purpose through my faith and just the things that I do on the everyday basis. So I know I have not filmed a video in a hot minute, but I promise you, I definitely have been working and I have been doing a lot in my public health class, and so that's what this video is actually going to be about. It's going to be about COVID-19 and specifically working with the homeless population and what my experience has been thus far. So if you are not subscribed to my channel, please go ahead and subscribe so whenever I upload content, you'll be notified. And at the end of this video, if you feel like it was helpful, it was useful, or you just simply enjoyed it, please don't forget to like this video. But if you are interested in learning about the experiences that I had with, or am currently having with, homeless individuals during this COVID-19 pandemic, then keep on watching. Okay, you all, so right now I am taking public health, and for my public health rotation, we were initially supposed to be out on Skid Row, and initially I had signed up for the Skid Row rotation because I do enjoy working with the homeless population, and I honestly just wanted to learn a little bit more about them. But before I go any further, for those of you who aren't from California or may not be familiar with Skid Row is an area in Los Angeles that is known for the plethora of homeless individuals that reside there, and it's a place that is very impoverished, and an area that Los Angeles County Department of Public Health has really been trying to clean up and work on and help these individuals, and ultimately just really do their best to alleviate homelessness within the Los Angeles area. So I was supposed to be on Skid Row, and due to COVID-19 and everything happening, of course, that was canceled. And as you guys already know, if you've watched my prior videos, everything is online now. Majority of students that are in school right now, they are doing all of their classes online. And I was bummed. I'm not gonna lie, I was really bummed because, like I said before, I was really looking forward to working with this population, but the only thing that is constant in life is change. So when things like this happen, you just have to endure the change and adapt. So what we are doing now instead is we are still working with the homeless population, but we're also coordinating with shelters that house individuals that are transitly homeless or chronically homeless, or just in between permanent supportive housing. And permanent supportive housing is housing for those specific individuals that have a hard time securing housing or are homeless. And so we're working with a specific organization here in Los Angeles, and we're really just trying to assess things that they are needing right now during this pandemic. And so we have a group project, and through this group project we are really catering to that role of being a public health nurse. So a public health nurse is different from a just staff hospital registered nurse, because a staff nurse caters to an individual, whereas a public health nurse is the public, like it states. But not only that, it also deals with the community versus the individual. So you are catering to an entire community. So for our project, we're catering to the Skid Row community. So with this project, we have been meeting with a multitude of stakeholders, and it's been really beneficial, I believe, to formulating the project that we have to create. And we really have been finding that these stakeholders and their employees have really been suffering from fatigue, from just dealing with this whole COVID-19 situation, and they've really been having trouble with implementing their self-care. So that is also going to be something that we're going to implement into our project. So more specifically for myself, I actually volunteered to do a program, and this program is called Miracle Messages. And with this program, you are paired up with a homeless individual, and you are basically volunteering to talk to them on a daily basis and check on them, see how they're doing. Are they suffering from any anxiety right now during this crazy time? Do they have shelter? Do they have food? Do they have water? And it just allows them to have someone to talk to every day. And also with these individuals being homeless, they don't necessarily know or have updates about their families, because some of them don't have cell phones, and the cell phones that they do have been supplied through a certain program. And so also what Miracle Messages does is reconnect homeless individuals with family, and they basically have the homeless individuals film 10-15 minute video, and then they go to work trying to find family and just try and connect them back. So it was a little tough at first, because the individual that I was matched with, he wasn't really responding to me, and I just wasn't really sure what to do. I was really nervous initially to reach out, because that's kind of awkward to consider yourself to be a friend to someone and you've never even met them. But I'm so happy to say that I was finally able to speak to my friend or buddy from the program, and he was a really nice guy, and he just continued to talk to me about his family that's in New York and how he missed his dogs, and was just really telling me during this time he does not like having to wear a mask, and that he just wants to go to the beach and just take off his mask and just smell the water, but he knows he can't do that because of safety reasons. So for me, it's just been very interesting, this entire public health course thus far, because it's really shown me a different perspective of nursing, and I really do feel like this is a great time to be taking a public health nursing course with this pandemic going on, and we're really able to see firsthand what a public health nurse can do in these conditions, and then having that extra challenge on top of that with not even being able to go outside and be on Skid Row and interact with these individuals. And that way we're having to find other means and ways to interact with these individuals. But I'm loving public health so far, and yeah, I'm just really excited for us to implement our project. We've been working really hard, and clinical days are really long days for us, but I understand that everything is going to come out nice. And other than that, you all, that's pretty much it. That's pretty much what I wanted to talk about in this video, is literally working with the homeless population and everything that's going on with COVID-19 right now, because the homeless population are very vulnerable individuals. I know in the media they're talking about individuals that might be more at risk, like if you have comorbidities. And for those of you who don't know what comorbidities are, it's just having 2 or more chronic conditions. And so if you have diabetes or you have hypertension, those would be comorbidities, and those 2 diseases actually do make you more susceptible and at risk of acquiring coronavirus, as well as if you have a low immune system and you're not able to quarantine yourself or house yourself or have soap or hand sanitizer or mask or gloves or these things that a lot of us may take for granted. So it's really, really important to make sure we're taking care of these individuals that are vulnerable and that are at higher risk of contracting this virus. So that's it. I will be filming another video for you all very, very soon. I hope you enjoyed this video. If you have any questions about anything I've said in the video, or if you're interested in Miracle Messages, or you just kind of like, I want to know a little bit more, I will post their website in the description, so you can click on the website and check it out for yourself. And if it's something you're interested in, then go ahead and try it out. I believe they do like for you to volunteer for 1 to 3 months, so just keep that in mind when you're looking into it. But that's it, you all. If you like this video, please give it a thumbs up, and like I've said before, if you're not subscribed to my channel, please go ahead and subscribe, and I will see you all in the next video. Be purposed. Bye.